Three, two, one, go! Welcome to the AskDrKan Show. This is the 92nd episode of the AskDrKan Show. 93rd episode. Oh my gosh. We are moving right along. So welcome to the show. This is Dr. Peter Kan. I'm a functional medicine doctor, and I help people with chronic conditions overcome their chronic condition using functional medicine, nutrition, lifestyle change, and just logical, no-nonsense approach to health. So in this episode, we're going to be talking about thyroid medications. Some of the things that you need to know about thyroid medications that your doctors do not tell you, your naturopath do not tell you, whoever nutritionist you're working with don't tell you about thyroid hormone. And there's a lot of assumptions and misconceptions that people make about taking thyroid hormone. So in this episode, we're going to talk about all these often heard things that are just plain wrong, some of them, and things that's going to cause problems for you. Okay, so we're going to talk about thyroid hormones. Now, thyroid hormones, we say thyroid medication, right? Thyroid medication. So these include your synthetics and your bioidentical. Your synthetics will be your levothyroxine. That's generic. And then your name brand will be Synthroid. But really what these are your synthetic T4 hormones. They're the most common one. And then you also have your synthetic T3, which will be your Cytomel. And then on the bioidentical side, you're going to have your Thyroid. I mean, there's a whole bunch. I'm just going to give you the most common ones that you're going to hear of. It's really Armour Thyroid. Okay, really irrelevant which one it is, because you're going to know really soon that all these hormones, they are hormone replacements. Okay, so these are bioidentical, and usually they're T3 and T4 together in both. Okay, if you don't know what T3 and T4 is, there are previous episodes that have talked about thyroid physiology. We'll have reviews along the way. So these hormones, there are thyroid medications because you have to get a prescription, right? Now, this whole thing about prescription drug, just a big old game, right? So the drug companies, they got a monopoly on this, and the FDA's kind of like, they all work together so that only things that are approved by the FDA can be called medications. So anything that's not approved by the FDA, you cannot say that it can heal or cure or anything like that, which is completely lame, because if you have diabetes from eating too much sugar and carbs, guess how you cure your diabetes? With food, not with a drug. So food does cure, food does heal, but according to the FDA, you can't. So I guess you can, because the government know everything, right? So I digress, not regress. So according to the pharmaceutical company, these are your medications. Now, we hear the term medication. We assume that these hormones are going to medicate your thyroid and somehow magically make your thyroid gland heal. That these medications is going to medicate the thyroid and make your thyroid gland work better. The reality is that thyroid medication does nothing to heal your thyroid or make your thyroid gland work better. What these things are, they're all hormone replacement therapy, HRT. You're just giving your body a hormone that your thyroid gland normally would make anyways. So thyroid medication doesn't medicate you, doesn't make anything work better. It just gives you a hormone that you're assuming that you don't have enough. Now here's a kicker. Most people with thyroid conditions or low thyroid symptoms actually don't necessarily have low thyroid hormone levels. I mean, how many of you watching, if you currently suffer with a thyroid problem, or you suspect you have a thyroid problem but you have not been diagnosed, or you know someone that have a thyroid problem, perhaps a loved one, your spouse, sibling, parents that have thyroid issues, but they tell them or tell you that your thyroid lab tests are normal, yet you still feel low thyroid symptoms, right? Your thyroid lab test may be normal, so they don't diagnose you anything because they say, oh, your thyroid's normal, it's got to be something else. Maybe you're just depressed. Here's Prozac, right? That's the ridiculousness of medicine. Treating symptoms, throwing drugs at problems without looking at the root cause. Or perhaps you already have a thyroid condition diagnosed, and you're already taking the thyroid hormone, but on follow-up blood tests, everything again is normal, but you're like, man, I'm taking this thyroid hormone, but all of my symptoms is not going away. Maybe you had a honeymoon period where in the beginning you felt some better, but over the course of time, it starts working less and less and less for you, and your symptoms just remains or it comes back. It's because these hormones are simply treating one problem, hormone deficiency. These thyroid medication will only fix your problem if your problem is one where you have not enough hormone to begin with. So let me show you this. If you have a hormone, say this is normal hormone amount and you have a hormone deficiency, taking a hormone replacement should make up for that deficiency, voila, all your symptoms should go away, right? Your weight goes away, you have ideal body weight, you can lose weight again, your energy comes back, your hair stop falling out, not mine, but your hair stop falling out. That should be what happens if you have a hormone deficiency. You don't have enough, you take some, boom, problem solved. If you're taking the hormone, but yet you still have hormone deficiency symptoms, then that means that ain't your problem. That means that hormone deficiency is not really what's causing your thyroid problem. Because for your thyroid hormone to function, not only you have to produce it, you also have to be able to convert it from an inactive form to an active form. So that's what these are. T4 is an inactive hormone. T3 is the active hormone. So your body has to convert T4 into T3 before your body can use that hormone. So if you have T4 but you can't convert it, this conversion is blocked somehow, and there are many reasons for that, then you're not going to be able to utilize the hormones that you got. Furthermore, these hormones, once it's converted, has to be transported. It has to get to your tissue. If that transportation is blocked, then even if you have the hormone, it ain't going to work. And then once it gets to the cell, it has to be able to latch onto the receptor and actually get inside the door. Get in the door of your cell to be transported in. If that receptor is blocked, again, you can have all the hormones in your blood, but nothing's going into your cell. So it's not how much hormone you have, it's how much you can utilize, right? So when we're doing a blood test for T4 and T3 on your blood, right, when your doctor runs blood work to check your thyroid function, what they're checking is not your thyroid function per se, they're checking thyroid hormone levels. And what happens is you may have a situation where your hormone level is normal, but nothing's going into your cell, or nothing's being transported, or nothing's being converted. So your hormone level looks fine, but you don't feel fine. This is why your doctor tells you your lab test is normal, but yet nothing's working for you. That can be really frustrating, that can be really scary, and that's obviously rightfully you should be concerned. And you need to find solutions, because if your thyroid hormone can't get into your cell, your body will start to degenerate. That's why you gain weight. Your brain will start to degenerate with low thyroid function because your brain cells need proper thyroid hormone for them to function. And that's why low thyroid is associated with an increased risk for dementia, Alzheimer, and all sorts of neurodegenerative diseases, Parkinson included. So we got to make sure that this is working for you. Okay? Now, these medicine not only work in the case of hormone deficiency, also is that the root cause of most people with thyroid problem is actually due to an autoimmune disease. Autoimmune. So for most people with thyroid problem, Hashimotos is the root cause of their thyroid problem. Hashimotos is an autoimmune disease where your immune system is attacking the thyroid gland. So in this particular case, your immune system is attacking your thyroid gland. And what that does is actually it can shut down thyroid hormone production. Yes, you can have a thyroid hormone deficiency from the immune system attacking the thyroid gland. More often though, Hashimoto creates inflammation. And this inflammation can actually block the hormone from entering the cell. Cytokines, or inflammatory cytokines, these are immune cells that trigger inflammation. These are immune system messengers that trigger inflammation, can block thyroid hormone from entering the cell. So in that particular case, you can take hormone all you want, but nothing's going in. So Hashimoto's create hypothyroidism, a couple of different mechanisms. One is that it actually just kills your thyroid gland, so you don't have enough gland to actually produce hormone. Therefore, you have hormone deficiency. The second reason is because the inflammation that it causes actually can cause thyroid hormone resistance. So the hormone you got don't work. So Hashimoto is the root cause where the immune system is attacking thyroid gland. In this particular case, you don't have a thyroid problem. Let me repeat that. Hashimoto's is not a thyroid problem. Hashimoto's is an immune system problem. Your thyroid gland is nothing more than the victim being attacked by the immune system. So let me ask you this. If you have Hashimoto's, where the immune system is attacking your thyroid gland, how much hormone do you have to take to get the immune system to stop attacking your thyroid gland? Put the answer in the comment section. Yes or no. Basically, the answer is no amount of hormone will help. Because thyroid hormone will only work for one thing. What's that one thing? A hormone deficiency. It will not stop the autoimmune component of the disease. It will not stop the immune system from attacking your thyroid gland. So you may take thyroid hormone for Hashimoto's to help make up for the hormone deficiency, but your immune system is still raging against your thyroid gland, attacking it, therefore creating a long-term problem. So essentially, taking thyroid hormone is a short-term solution. It's a temporary solution. Or it's one aspect, a small piece of the puzzle. You must address the bigger picture, which is the autoimmunity. Taking thyroid hormone, whether it's natural or synthetic, does not stop the immune system from attacking the thyroid gland. That is so important for you to understand that I want you all to put a comment in the section, say, I got it. That you understand this point. And now you go out and share this with other people and teach other people with thyroid problem what this means to them. And find real solution that can actually fix this problem. Taking the thyroid hormone does not fix Hashimoto's. However, when it comes to standard medical treatment, right? When it comes to the medicine, the pharmaceutical company, and FDA, and medicine is concerned, treatment for Hashimoto's is the hormones. That's all they do. That's the standard of care for thyroid problem, thyroid hormones. Now, if you go to a natural alternative doctor, then their standard of care, instead of synthetic hormone, they're going to tell you, oh, bioidentical hormone's better. BS. It's not necessarily better. I mean, what are you doing to fix the autoimmune component of the disease? Nothing. Just because it's bioidentical doesn't make it any better. It's still just a hormone. It's just, instead of a synthetic hormone, it's a hormone derived from pig thyroid gland. That's it. So people have this notion that, oh, I'm taking bioidentical hormone, it's going to be better for my thyroid gland. And it's going to medicate my thyroid better. Somehow make my thyroid gland to function better. Somehow kick my thyroid into gear so that my thyroid gland can start to make more hormone on its own. Taking the thyroid hormone doesn't do that at all. Not one bit. That's the myth. That taking thyroid hormone is going to make your thyroid gland work better. In fact, taking a thyroid hormone, whether it's bioidentical or synthetic, it's going to cause your thyroid gland to stop working. Because any hormone gland in your body, when you take an exogenous source of hormone, an outside source, it's going to stop your own thyroid gland, stop your own hormone gland from functioning. Because your gland works on a negative feedback loop. So the more hormone you have in your body, the more your brain says, I got enough hormone, so I don't need to make any more. Just like you give somebody a handout, right? You give somebody, money and they have no reason to go to work, then that person's going to become really lazy because they're getting fed. They don't have to do anything. Same thing with your body. If you don't work your muscle, it'll atrophy. If you don't work your brain will start to, you don't build new synaptic connections, right? It's not that you became stupider. It's just that you don't build new networks in your brain. Anything in your body, you don't use it, you lose it. So if you're taking a hormone from an outside source, bioidentical or synthetic, you're basically telling your thyroid gland, say, hey, we don't need you to do any work because I'm taking this pill every day. Your thyroid gland is going to start to atrophy and it will not produce hormone anymore after a period of time. It'll just completely inhibit it and it's going to shut it off. That's not a good situation. Okay, so this is really important to understand. Please put a "I got it" in the comment section so I know you understand this point. This is so important. It's going to change your life, because once you understand that most people with thyroid problem have Hashimotos, and that the root cause of thyroid problem usually is not because of a thyroid hormone deficiency, because you can have problem with conversion, with transport, or cellular resistance, or inflammation, and that's really where you got to play. That's what you got to fix in order for you to not just overcome thyroid problem, but to be healthy overall, to have everything working. All right? Let me say a quick shout out to Suzanne. Suzanne got it. Awesome. That just makes it all worth it for me today. Joan, good to see you. And we have Allie. What's up, Allie, on Instagram? What's up? Allie's, are you still in North Carolina? All right. All right. Thank you for joining us. So, another point with thyroid medication that you got to understand is that I get a question, people ask me, is one better than the other? And I hope I just answered that. Now, in some cases, you can actually get flare-ups from taking these medications. For example, when people have Hashimotos, autoimmune disease, your immune system can be so sensitive, so overactive, that you can actually start to develop sensitivity to different foods and ingredients. So one of the things that's really commonly associated with Hashimoto is gluten sensitivity. Now, what happens is these synthetic medications, many of them contains gluten fillers in the medication that you can actually react to. So for example, if somebody has Hashimoto's and they're very gluten sensitive, so they make a big effort to go gluten-free and cut out all the gluten in their diet. However, every day that they take medication, that they're basically getting a gluten exposure and they trigger an autoimmune flare-up. So people, they never get better, even though my diet's perfect, but they're getting this gluten filler from the medication. Okay? Now, how about gluten in other sources? Yeah, gluten is found in other medication as well. So maybe you're on 3 medications, and you say, well, my thyroid medication doesn't have gluten filler. But guess what? Your blood pressure medication does, or your other medication does. So you got to watch out for these things. Another thing is that gluten can also be found in insidious things, like in the environment, salad dressings, condiments, things that you not think of, so you can get cross-contamination. Another thing you got to watch out about gluten is that it may be found in people who Christians. Maybe you take communion. The communion wafer may contain gluten. So here you are eating perfect, but the communion wafer may be messing up. So you must speak with your church. Usually you can bring your own communion wafers by bringing gluten-free versions of it. Use rice cracker instead. So there's things you can get around it. Okay, you just got to be careful of that. But know that medication can contain gluten fillers, and that can cause immune reactions and flare up your Hashimoto. Now, on the natural side, what happens is some people have autoimmune to both a TPO antibody and thyroglobulin antibody. These are both blood tests that you need to do to check if you have Hashimoto's. You need to check both, not just one. Okay, these are 2 different tissues on your thyroid gland that your immune system can attack. And what happens is in people who have reaction against thyroglobulin antibody, where that's positive, you have that form of autoimmune test pattern. And what happens, thyroglobulin, by the name implies, thyroglobulin, protein found on thyroid gland. Okay? And this is actually a component of your thyroid hormone. So for your body to make hormone, it basically uses thyroglobulin and combined with iodine to make the actual thyroid hormone. So if you have autoimmune attacking this part of your thyroid or your body, what that means is you can potentially have autoimmune against your own thyroid hormone. Okay, this can happen. If you have immune system attacking your own thyroid hormone, that kind of sucks, because you need thyroid hormone to feel good, but your immune system's attacking the thyroid hormone. This is a pretty delicate situation, and we have quite a few patients that have this, and this requires special management. But what I'm telling you here in regards to the medication is that in people who have autoimmune to thyroid hormone, you may have problems with bioidenticals, because your immune system's attacking bioidentical thyroid hormone, which is your own hormone because you have autoimmune. It can start to attack these bioidentical hormones. This is where people says, it's weird. I was given bioidentical Armor, Nature Thyroid, and I didn't feel good on those. When I switched to Synthroid, I feel better. So this is where some doctors just hell-bent on giving you bioidentical, saying it's better, but it's not necessarily better. It depends on the person. So a lot of it is just, you got to know what's going to work for you. Don't just listen to somebody tell you, this has got to work. Not necessarily so. That is so important, okay? Another question that I get often is, when is the best time to take thyroid medication? Now, I get a lot of people who says, hey, my doctor telling me to take thyroid hormone in the morning. So then there's that time period where you're not supposed to eat anything with it for like an hour. So that kind of pain in the butt, because you got to take your hormone. Some people, I have patients who, they wake up at 4 in the morning to take the hormone, so they can and go back to bed, and so they can get up at 5 again just to have breakfast and then go to work. So I'm going to tell you that there's actually a study done where they take people and they give them thyroid hormone at night, at bedtime, and they found that people don't necessarily have a problem with it. The reason we were telling people to take it in the morning, because we assume that if you take thyroid hormone, you're going to get this boost of thyroid hormone in the metabolism, so you may not be able to sleep. And what happens is, when they give the thyroid hormone to people at night, they found that these people were actually able to sleep just fine. And what they also found is that on their thyroid lab tests seem to be more stable. It seems to work better for them. Again, I'm not telling you to take it at night or in the morning, because you kind of have to try it, work with your prescribing physician, try to take it at night, see if that works for you. Because what happens, the hormone just get absorbed overnight, so they wake up in the morning, you can just get going and start eating breakfast or whatever you need to do without having to wait that extra hour. So that's something that could be empirically tested for you, and see if that works for you, okay? We have a question from Joan. If you have Hashimotos and are on thyroid medication, how do you know when to lower or come off Synthroid? Great question, Joan. So we have helped a lot of our clients get healthy and recover their condition to the point where they don't need medications anymore. And the way you do that is you have to use a combination of lab tests and also your symptoms. Because with people with thyroid issues, lab tests is not always going to be stable. The thyroid hormone level is going to fluctuate, especially when you have Hashimoto. It can fluctuate quite a bit. It's almost like you can very difficult to stabilize that number, because you have your immune system that just flare up and attack your body, so it can be really difficult. So you have to kind of know. You have to judge by your progress, your condition, in conjunction with lab tests. And typically when clients work with us, the better they do, the longer they've been under our program, the more stable their system become. And then we have a more predictability with their symptom and with their condition. And then the lab tests will start to correlate more, and we can help them wean off. So basically, it's something that has to be taught. It takes a while. It's not something I can just give you a handout. It's not just like, if your lab test is normal, because a lot of people, their lab test is normal, but they still don't feel normal. So you can't just use lab tests as a guide. You have to look at blood sugar levels, you have to look at liver function, you have to look at all of it. See, managing thyroid is a holistic issue. It's not just simply, what's the one thing that I do? It's multiple things. It's kind of like health overall. It's multiple things. And especially if you have a really complex condition, chronic condition, like thyroid, like Hashimoto's, like autoimmune, like chronic fatigue syndrome. These are all complicated things with not one simple answer. So really, we have to look at the whole picture. But the bottom line is you use a combination of lab tests and your symptoms, and it depends on how long you've been working on it and what progress are you making. If you're getting a lot better, then we can start to look at your lab tests and correlate that. Okay, so hopefully that answers your question. Sorry, I don't have a simpler answer for you. So that's my time today. So thank you all for coming to the show. If you like this, if this content helps you, please subscribe, or I should say on Facebook, it's like our page and share our posts. That's the most important thing you can do, because once you know this information, you know that there are other people out there that need to hear this too. So please help us share. I'm doing this out of my own time during practice hours. I'm spending half hour of my lunch hour to do this because I want to share this information. There's so many people that need to hear this, and they're getting information that's just simply not accurate, or it's like a myth, or it's folklore, right? It's like medication, but they're just hearing folklore information. We want to set the record straight. Please share this video with those that you know on Facebook. We also put this video on YouTube. Please subscribe to our YouTube channels. We also do in-office workshop. If you're in the area, in Arizona, you can come to our autoimmune solution workshop this Wednesday at 5:30. You can register online at azautoimmunedoctor.com. I'll put the link on the comment section so you can click and register for the workshop. It's one of the most beneficial workshops because it's going to give you really a great information about not just Hashimoto but autoimmune in general. So if you have any condition that either you're diagnosed with autoimmune disease or you have a condition that your doctors simply don't know what it is, it may be autoimmune. So come to the Autoimmune Solution Workshop to learn what are the different things you need to look out for, what are the natural things you can do to get better. This Friday, we have a new series, the Mix series. So the Mix is a show where I make healthy recipes, and the going joke is that I can't cook, so I'm cooking to show you how easy and simple it is to make healthy, delicious, and nutritious food fast, fun, and easy. So this Friday we have a new series on Instant Pot recipes. So you don't want to miss it. And if any of you are interested in having a consultation with us, you've been struggling with chronic energy problems, you have brain fog, you feel depressed, you feel you have lack of motivation, you have chronic digestion issues, bloating, gas, constipation, IBS, you have mood issues, depression, anxiety, and you're just sick and tired of the merry-go-round, right? Doctors giving you Russian roulette of medication. Just try this, try that, and there's no answers. You just want real answers based on real science and real logic. Then a case review is what you want to do. And we do this with clients all over the world, really, globally, not just in America, through Skype. So you can consult with us through Skype or FaceTime. It's been working really, really well. Clients tend to respond really well to having that additional support, to have me always there to help them. So you can request for a case review by either direct message me, PM me on Facebook, or DM on Instagram, or call us at 480-988-6269. I look forward to meeting with you and helping you discuss your health challenges and help you find sensible solutions that's going to help you get well and stay well. Thank you so much for watching, and I look forward to seeing you next week at the AskDrKan Show. Take care.